Hello, my name is Eugenia Canas. I speak to you from Canada, where the Young Health Program has partnered with 3 national organizations, one of them Mind Your Mind. We're a national engagement program staffed by 12 and reaching out to over 1 million youth every year through our online and social media spaces. We focus on youth-adult partnerships to co-create resources and information that fight the stigma of mental health. A vital element of the Mind Your Mind culture is trust in youth's own inner strength and resources. We foster conversations and empower youth with information so that they can reach out, get help, and give help. But first, let me describe to you the Canadian landscape for youth mental health. 70% of mental health problems have their onset in adolescence. 1 in 5 young people who need mental health services currently receive them. And Statistics Canada tells us that only 1 in 4 youth with a self-identified mental health concern will access formal or informal supports. Youth need champions. Sustained, meaningful, and genuine engagement has been deemed key in mental health. Our program evaluation shows us that when youth spend time on Mind Your Mind's online spaces, it impacts their help-seeking behavior. 63% of youth accessing our resources reach out to a trusted adult or health professional. This is 158% of the national average. Our work within the Young Health Program has increased our capacity to develop resources and engage with youth and the professionals who serve them. Young adults are part of every stage of our process. This level of engagement ensures that materials created speak the language of youth and reflect best clinical and research practice. Today, I will share with you key principles of our engagement model and describe the process of a unique engagement initiative undertaken by the YHP on its road to Istanbul. Key strategies to address stigma and barriers to access will differ across countries. We need youth to help us determine what works. Engagement is critical in our process because it allows us to create and disseminate information that is relevant to youth, increase their language capacity on the subject of health, share young adults' lived experience to normalize the conversation about mental health. Let me give you an example. Through the Young Health Program, youth were engaged to work alongside Mind Your Mind clinical and creative professionals to develop the series Mental Health A to Z, online educational modules addressing issues of stress and wellness. They also created a mood tracking application called Mind Your Mood. Youth were involved in the conceptualization, development, and dissemination phases, as well as in reviewing and testing for usability, accessibility, and relevancy for both tools. To engage youth in this way, we draw on an organizational toolkit that includes partnership, co-creation, and the willingness to change and be changed at every step of the way. These are the cornerstones of our engagement model. In your delegates package today, you will find our toolkit for engagement. This toolkit is designed to help you think about issues of engaging adolescents in your own practice. As a concrete, transferable tool, it will empower your organization with step-by-step engagement tips, as well as opportunities to organize and reflect. In preparing for our talk here, we reached out to youth in the global North and South, seeking to capture their perspectives on their own health states. To do this, we piloted conversations with youth via postcard, sending 2 key questions to young people in YHP programs in Brazil, India, Spain, and Canada. We relied on YHP networks and services in each country and reached, over a 5-week period, over 260 respondents. We asked, when it comes to your health, do you feel your voice is being heard? And what would you change in your community to improve your health? We collected responses and analyzed for themes across settings. This postcard initiative is the beginning of a conversation and demonstrates the value of seeking out youth voices. The process has yielded as much insight as the information itself because of what it tells us about the ways youth engage and seek to take more agency with regards to their health. Youth in the global North and South answered predominantly yes to whether or not their voice was being heard. This question was interpreted in different ways in each country, based on cultural and traditional assumptions, as well as the activities and relationships occurring in each young health program context. For example, in Brazil, young people spoke loudly for system improvements that will impact their health, with 82% of recommendations focused on system improvements. Youth's call for system improvement were diverse and very much embedded in the geographical, cultural, and economic setting where they live. Environmental concerns were also prominent in all countries, underscoring findings of the impact of environment on youth health. In the Global North, the environmental ask was around provision for greener spaces, while in the Global South, clean communities and sanitation were overriding concerns. These findings are important because of what they reveal about engagement and how they reinforce Mind Your Mind's commitment to partnership, co-creation, and the willingness to learn and be changed by youth. Engagement is partnership. All the elements that make up a good partnership, such as mutual respect, consideration, exchange of ideas, and joint expertise, apply. Partnership is impacted by hierarchy dynamics, degree of mutual knowledge and trust, and mode of facilitation. Key in engagement is meeting youth where they're at, in the places, settings, and modes of communication where we can engage. 48% of Canadian youth answered the postcard questions online. This led to answers being nearly 4 times longer on average than a handwritten answer. The ability to prepare for and reflect on the question and the ease of technology used for youth in Canada impacts the nature of their responses. Co-creation strengthens your engagement process. Youth and your organization may speak different languages, verbal or otherwise. Good engagement includes youth-friendly language, diverse learning methods, and non-verbal models as well. Theater is being used in Brazil for the peer education program. And in Canada, arts-based methods for the development of tools and resources empower youth to say more than they thought they could. Every time we co-create with youth, we are modeling and practicing the listening, respect, and collaboration that are hallmarks of good engagement. Youth who are empowered to create develop stronger voices, as well as a trust in a partnership where their views are valued. And finally, engagement is also about the willingness to change and be changed. Expect a process of acculturation where all parties take chances out of their comfort zones and learn to establish and re-establish what they know and don't know. As in other forms of effective partnership, youth engagement acknowledges the youth and the community's value systems. Youth in India are saying, we want education not just for us, the youth, but also for our communities. This touches on long-standing hierarchical and traditional models of operation within the culture. This kind of response also poses a challenge to our expectations of what to prioritize, asking us to expand our vision, shake up assumptions, and relinquish forms of control over our own process. And in Canada, Canadian youth displayed a comfort with challenging established and interrelated practices, and with asking for systems and institutions to provide for themselves and others. When you engage youth meaningfully, the conversation gets richer, deeper, and more complex. Youth engagement is a right. Young people have the right to be heard, express opinions, and be involved in decision-making, per the UN Convention on the Rights of the Child.